Hey everybody, I want to go over some stretches that I want to do for and show for you. This is some of our fundamental low back, lower extremity, hip issues that we find in connective tissue dysfunctions. These are my go-to stretches and I want to share them with you. Let's start with my first and foremost hamstring stretch with a bit of a variation. So all I really need and recommend for you to use is a stretch strap. I prefer a nylon one. I don't prefer the rubber ones. They give too much. So, simple place. We're going to do our left side. Loop it around the foot. Grab a good length. I always recommend to loop it around the ball of the foot, not the arch. It's going to give you a better calf and arch stretch. Lift your leg up, lean back, and lift to a point of stretch of medium intensity. Now, I really make that a huge emphasis. One of my fundamental rules, the stretch should never be more than medium or moderate. My moderate is not your moderate. So I always ask people somewhere between too much and too little, something in the middle. So play with it for the first few times. Pull up. Okay, that's too much stretch. Come down. I don't really feel a stretch at all. Find somewhere in the middle and hold. Next question, how long? 60 seconds. Do yourself a favor. Wait 60 seconds at a medium intensity. When that first minute is up, and you've counted it on your iPhone or your stopwatch or whatever, then you take your leg open. You do that by letting your leg open up. Now that's going to stretch the inside aspect we call the adductors. If you need to, you can bend the other leg, you can flare it out, you can keep it straight, but pull till you feel a medium stretch on the inside. Again, medium, hold, 60 seconds. That's the second stretch of the hamstrings. After the 60 seconds, you rainbow it across your body. Boom. Straight leg, medium intensity stretch is going to show up all the way through the outside of your leg, outside of your knee. Some people feel it on the outside of the calf. Wait. Where? Medium intensity. Pull too far, not going to last. Don't pull far enough, not going to feel a stretch. Somewhere in the middle, wait and hold. 60 seconds at moderate intensity. This is the third position of my suggested hamstring stretch. Good. Let's segue to the next stretch. Main components of a lot of this lower extremity issue is hamstrings issues, glute issues, and hip flexor issues. So I'm going to show you the glute and piriformis stretch that I recommend. Assume the position will go on your back, both knees bent, like so. I'm going to stretch the glute and piriformis of the left side. What we do is bring the leg across the other, let it rest comfortably. Take both hands, interlock them, grab the top of the outside of the knee. And one important aspect that I always cue patients in is to bring the knee across your body in a diagonal. It's very different. Not this, but up and across, aiming towards your opposite shoulder. And you should feel a stretch right in through here. The same three rules apply. Moderate stretch, 60-second hold, and repeat it 3 times. So here, boom, at a minute, what I recommend to do, because your pelvis is a semicircle, do it to the other side. Flip the leg, interlock the fingers, grasp the outside of the knee, bring across your body, pulling it into a direction of the opposite shoulder. Remember to breathe through it, don't hold your breath, and find your medium, moderate load stretch. Good. Let's segue to the third. Again, I talk about primary movers of the lower extremity. Hip flexors are another one. Very important. Hip flexor stretch, something that you can do at home, at the gym, at a treatment table, wherever you can find some leverage. Just open up this area, which is such a powerful muscle. So I recommend if you have a treatment table, fantastic. If you have the edge of your bed, that's fine as well. Just learn how to position yourself so you don't fall. Lay at an angle. All right, so I recommend lay right now at an angle, bring the pocket or the very edge of your hip to the very edge and get a little more purchase on whatever you're laying on. We're going to stretch the left hip. So what we're going to do is we're going to bring the right hip up to you, give you a little bit of a comfort hug, and then the left hip is just going to descend and hang. So we're using gravity assisted stretch. Just be careful to know that your glute muscle is off of the edge of the table so it doesn't prevent you from really opening up. Now my hip flexors are tight, so I need to do this a little more often. But here is where you're going to use a pattern of time and pressure. 60-second hold. Let your hip open up. You should feel a gentle stretch happening to the front of the thigh, the hip that goes down. Remember to relax your knee. Avoid keeping your knee straight. That won't help you. Let it open up. Use your diaphragm. Release and hang. How many times? Suggested 2 to 3 time repetitions of a minute hold each. All right, awesome. Good. Thanks for watching.